Let's talk about a condition you might not have heard of, but definitely don't want to experience: diverticulitis. This condition can sneak up on you, often without warning, and can cause significant discomfort. Imagine your colon, the lower part of your digestive tract, looking a bit like a worn-out garden hose with tiny pouches poking out from the sides. These pouches can be harmless, but they can also become problematic. These pouches, called diverticula, are actually quite common, especially as we age. In fact, many people over the age of 40 have them without even knowing it. They usually don't cause any fuss, but when one or more of these pouches become inflamed or infected, that's when the trouble, diverticulitis, begins. This inflammation can lead to severe pain and other complications. Though the thought of inflamed pouches in your digestive system might not be the most pleasant, understanding diverticulitis is important. It can help you recognize the early signs and seek treatment promptly. It's a surprisingly common condition, and knowing the signs and symptoms could save you a lot of discomfort and potentially even more serious complications down the line. Symptoms can range from mild to severe, including abdominal pain, fever, and changes in bowel habits. So, let's dive deeper into the world of diverticulitis, exploring its causes, symptoms, diagnosis, and treatment options. By understanding this condition better, you can take steps to manage it effectively and maintain your digestive health. As mentioned, diverticula are small, bulging pouches that can form in the lining of your digestive system, most commonly in the colon. These pouches can develop over time, especially as you age, and are often found during routine medical exams. Think of them as little pockets that protrude from the intestinal wall. They can vary in size and number, and their presence is often linked to a low-fiber diet. These pouches are often harmless and don't cause any noticeable symptoms. In fact, many people live with diverticula for years without any issues. Many people have diverticula without even realizing it. They are usually discovered incidentally during tests for other conditions. Diverticulitis, however, is a different story. This condition can cause significant discomfort and requires medical attention. This occurs when one or more of these diverticula become inflamed or infected, leading to a range of uncomfortable and sometimes even serious symptoms. These can include abdominal pain, fever, and changes in bowel habits. The exact cause of this inflammation isn't always clear, but it's thought to be triggered by factors like trapped stool, bacteria, or even tiny food particles that get lodged in the diverticula. Maintaining a high-fiber diet and staying hydrated can help reduce the risk of developing diverticulitis. While the exact cause of diverticulitis remains somewhat of a mystery, there are several factors that can significantly increase your risk of developing this condition. Understanding these risk factors can help in taking preventive measures and managing your health more effectively. One of the biggest culprits is age. As we grow older, our bodies undergo various changes, and our digestive system is no exception. As we get older, our colons naturally become weaker and more prone to developing diverticula. This weakening of the colon walls makes it easier for small pouches, known as diverticula, to form. In fact, diverticulosis, the presence of diverticula, is found in more than half of people over the age of 60. This statistic highlights the importance of monitoring colon health as we age. Beyond age, other risk factors include a low-fiber diet. A diet lacking in fiber can lead to constipation and increased pressure on the colon walls, contributing to the formation of diverticula. Lack of exercise, obesity, and smoking are also significant contributors. A sedentary lifestyle can slow down digestion, while obesity and smoking can exacerbate inflammation and other digestive issues. Additionally, a family history of diverticulitis can increase your risk. Genetic factors play a role in how susceptible you are to developing this condition. Long-term use of certain medications, like non-steroidal anti-inflammatory drugs, or NSAIDs, can also increase your chances of developing this condition. These medications can irritate the lining of the colon, making it more vulnerable to diverticulitis. Diverticulitis can be a bit sneaky, sometimes causing no symptoms at all. However, when symptoms do strike, they can range from mild to severe and often include persistent abdominal pain, usually on the lower left side. This pain might be accompanied by other digestive woes like bloating, cramping, constipation, or diarrhea. In more severe cases, diverticulitis can lead to fever, chills, nausea, vomiting, and even rectal bleeding. If you experience any of these symptoms, especially severe pain or bleeding, it's crucial to seek medical attention immediately. Don't try to tough it out. Prompt diagnosis and treatment are essential for preventing complications.